So here's a question from the audience about someone who has bursitis around the pelvis, has had cortisone injections using ibuprofen, not getting any better. What to do next? First off, what is bursitis? Bursitis is an inflammation of the fluid sacs along the side of the bones where the tendons insert. Usually they're there to act as a cushion to prevent more irritation of the bone. In some people, that bursa can get irritated and swollen and inflamed, which can then lead to more pain. That's bursitis. So the first question is, does this person really have bursitis? Here's what I mean by that. If it's truly bursitis, then under imaging, let's say ultrasound, you should see a fluid sac, a fluid collection. You should be able to take some of the fluid out and even check to see why is it inflamed or is it inflamed. So number one, is there true bursitis? Or under normal circumstances, what you actually see in someone who's been diagnosed with bursitis is actually not bursitis, but actually tendinitis or weakness of the tendon at that side. And it's common to make that mistake. Physicians frequently make that mistake in terms of calling it bursitis when it's actually a tendinopathy or tendonitis. And that might be part of the reason why this individual is not getting better with just a steroid injection. So around the pelvis, there are generally three different spots where you can see bursitis. There's on the side of the hip, the front of the hip, or the back of the sit bone. And when I see someone who's not getting better, it naturally makes me think, is there something else going on rather than true bursitis? So let's say you do have an irritation of the tendon. Sometimes a steroid injection can help with that, but a lot of times it doesn't because you're not actually treating the issue, which is weakness in the tendon, tendinitis, an injury to the tendon, or instability. Sometimes what's been called bursitis pain, let's say on the side of the hip, is actually discomfort that's coming from the SI joint or SI ligaments or from the lower back. So it's actually pain that's being referred from a different area that's being experienced in another area, and that might also be why not improving with a steroid injection. So knowing that most causes of pelvis or hip bursitis are actually more tendinopathy issues or more weakness or irritation of the SI ligaments or a pinched nerve in the lower back, the first line option really should be core and hip strengthening to begin with to make sure you're maximizing stability in those areas. And if you're still having pain that has been described as bursitis, then you need to definitely get some imaging. That might be, based on your examination and based on your history, that might be an MRI or an ultrasound to further evaluate either the tendons or the lower back to see if there is other pathology that could explain your actual bursitis symptoms. And then, if you're still having pain despite the right sort of core and hip strengthening exercises, then you might be someone who's a proper candidate for Prolotherapy or PRP treatment to actually strengthen the tendons, the ligaments, treat an inflamed nerve, to kind of calm that down, to see if by utilizing a regen med treatment approach, we can actually more appropriately and long-term treat your hip or pelvic bursitis symptoms.